maisha yangu. Sawa sawa? Shika huku, sawa sawa, lakini hapo usifanye nini? It's a very important area. Sawa sawa? Wonderful. But as you exercise, you need to aim to move the main muscles in the body. So there are muscle groups we call the major muscle groups. Okay? For example, usiwahi sema ume-exercise kama you have not exercised the thighs. So how do you exercise the thighs? You have to exercise. Unaona hii nyama ya hapa nyuma Very important. Sawa sawa, very important. Then the abdominal muscles, the chest muscles, then the muscles of the hands and the upper, the arms. Very important. And I'll tell you the best exercise that can engage all those muscles together. Okay? How do you know you have exercised all the muscles? It's easy. Anywhere you have a joint, anywhere we have a joint, that joint has to move. Kwa hivyo, how do you move the ankle joint? How do you move the ankle joint? How do you move the ankle joint? When do you strain? Because I'll tell you something else. There must be resistance in order for you to benefit from any exercise. Now, when do we have the most resistance on the ankle joint? It's when you are tiptoeing. Unaona wakati unakanyaga na ile sehemu ya mbele ya mguu. Okay? And the best way to do that is when you're jogging. So what I mean here is somebody who walks. Si mnajua kutembea? Ni nini huwa inakanyaga kwanza when you're walking? Is it the heel or the front of the foot? When you're walking, msiwe kama ngamia, because ngamia ndio inafanya hiyo mambo mnasema. Lakini human beings, as you walk, which is the first area to step on the ground? The heel. What happens when you are running? Which area is the first to step on the ground? Hapa mbele. Sasa, that is the difference. So that when you're running, you are straining hii nyama iko hapa. Okay? And this one, the calf. It's called the calf muscle. This one. This is called the second heart. How many hearts do you have? One, isn't it? This one, But then, these two, we call them the second heart. Why? Once your heart pumps blood from here, and it goes out, we do not have another heart to bring the blood back. What does that? Are the muscles. Okay? And that is why if you use your leg muscles, you can pump back the blood to the heart. So we need to exercise all the major muscles. Kuna watu hawatumii tumbo zao. Wanafikiria hii tumbo ni ya kuweka kitanda. Hiyo ni makosa sana. Sasa. The other time I told you that the center of gravity lies around your waist. Sasa. So you can divide your weight into two. Half of your weight is above the waist. The rest of the weight is below the waist. And now we have the center of gravity around this area. Now, if you press your stomach, your abdomen, most likely you are going to remain with only 4 centimeters of your bone at the back. Just 4 centimeters. So meaning, it's the 4 centimeters that carry your weight. Now, if you do not support that bone with your abdominal muscles, it means you are going to develop back pain at some point in your life. Tuko pamoja? Because umeachilia mifupa yako ilaliwe na, if you are 70 kgs, 35 kgs, zimelalia hiyo mifupa. So the only way you can support your bones, your 4 centimeter thick bone, is to train your abdominal muscle to carry your weight for you. Kwa hivyo wale watu wanatembea tumbo imelalia waist, hao watu waendi bali, utawakuta wameanguka huko, hawataenda sana. Sawa. But if you always tuck in your abdomen and walk, when your abdomen is tucked in, you can walk and run, and I'll show you that. That is the secret of getting rid of back pain, okay? So you have to work out the major muscle groups, okay? And ensure that you benefit from very good blood supply, because exercise will also make your blood vessels to be elastic. We don't want stiff blood vessels. When we are taking your blood pressure, we take it on a blood vessel, not on the heart. But we call it your blood pressure for the heart. But we take it on a blood vessel, isn't it? Now, when your heart pumps blood, the blood vessel is another heart. Once it receives that blood, it's supposed to do what we call, like the way a gun does. Pull the trigger, a gun has something we call, once the bullet goes, it goes back. Tuko pamoja? Ama ukivuruta bladder, ukiachilia, inafanya nini? Yes. Sawa. Ukivuruta inafanya nini? It throws the whatever, the missile. So what we are saying, when your blood vessel receives blood, it's supposed to throw it far, okay? And any point of your blood vessel is supposed to do what? To push the blood further and further away until it gets to the extremities of the body. So, if you have a stiff blood vessel, it loses what we call that recoil activity. It loses the elasticity. So a stiff blood vessel, instead of reducing pressure, it increases pressure. Kwa hivyo watu wengine tukipima your blood pressures tunakuta zikiwa juu. Why? Because the blood vessels are stiff. And you can make them elastic by doing exercise. Then, very important, a 4-minute routine. At least for the major muscle groups. So, I need you, or at your own time, tunaweza exercise the thigh muscles. The strength of the knees is very important. So, if you can squat, and you sustain that squatting for 4 minutes, are we together? Then you know you have catered, you have exercised the thigh muscles and the leg muscles. The thigh and the leg. Okay? You also need to exercise the biceps and these muscles that are here. So you can practice pulling your friend. Tuko pamoja. Munaweza pimana nini? Nguvu. Na tena ile munaekelea hapa. Munapimana hivyo. It's very important. Ama you can lift what? Something from the ground. And the best way to lift something from the ground, hebu angalia hapa. because you are hurting your back and you do not know. Huwa naona wengine wanainua chuma hivi. Hii ni mbaya sana. Hebu achana na hiyo mambo. Nani alikuonyesha hivyo? Ati unainua hivi. You see, the structure of your body does not allow you to do that. Any weight that you are lifting from the ground must be lifted in a squatting position. Tuko pamoja? Hii nyingine ya competition ama ya weightlifters hiyo achana nayo. Because we want to make sure you do not hurt your body. So any weight that you cannot lift when you are squatting, that is beyond what you can carry. It is going to hurt you. Tuko pamoja? Hii chuma munainua ama mawe munainua mkiwa that is not allowed. Sasa hiyo ni ya kupimana nguvu, and it has nothing to do with improving your physical health. Kuna shida? Okay. So, I think that one is clear. So weightlifting should be differentiated. The one for competition and the one for good body health. Okay. Now let's look at something else. Another very important point. Optimal timing. Because the body can replenish its nitric oxide supply every few hours, allowing for multiple high-impact short sessions throughout the day. I'll tell you the benefits of nitric oxide. The other time I told you, there's an abundance of nitrogen in the atmosphere. One of the medications that we give you for blood pressure is a drug that is very expensive. One tablet is 120 bob, okay? For people who have resistant hypertension, meaning your hypertension cannot be controlled by any other drug, you go and buy that drug. It is made of nitric oxide. You can enjoy or trap nitric oxide naturally from the atmosphere. There's a lot of nitrogen in the atmosphere. And when you're exercising and you're doing what we call nose breathing, you can convert the nitrogen into nitric oxide in your nostrils, okay, and in your lungs. So that once this compound goes into the blood vessel, it relaxes. It relaxes your blood vessels. And that one reduces your blood pressure. So, who is going to benefit from the nitric oxide? Anybody who does what we call nasal breathing, as opposed to those who breathe with the mouth. Kuna watu huwa wakifanya mazoezi, unaona wamefungua mdomo. Munaona kama wamefanya kazi ya muhimu sana. Okay? But they are not benefiting from what? Nitric oxide. Because it's converted in the nostrils and in the lungs. Then breathing has to be nasal breathing, okay? So as to increase nitric oxide levels. And then additional benefits are like enhanced stamina, reduced blood pressure, issues to do with breaking down elements like blood sugar in the body, what we call metabolic health. If you want to benefit from the food that you're eating for very efficient conversion of that food into energy, then you have to exercise. Okay? Kwa hivyo, sasa hivi umeona, the way you used to look at exercise is different from, I think you've got another picture, how important exercise is. Now there is what we call progressive resistance training or exercise. Because unless we exercise against resistance, we may never benefit from exercise. And these are some of the examples of resistance training. Okay? Unaweza fanya press-ups or what we call the push-ups, mountain climbing, you can do the sit-ups, okay? You can do the pull-ups, the chin-ups, okay? So all these are forms of resistance training. So I do not recommend people to exercise in a room. Because within a room, you do not get these benefits. Why it is good to exercise in the open, there are many reasons for that. But part of the reasons is, especially you are doing cross-country, the topography or the surface is not even. So sometimes you're climbing up, sometimes you're going down, sometimes you're running on a level ground. And we know that any exercise that involves climbing up is very good for the heart. Any exercise that involves climbing down or moving down the slope is very important for bone health because you're moving against gravity. You have to resist to fall or to continue moving down. So that resistance improves your bone health, makes your bones to be strong. Are we together? Anybody who is 30 years and above here has stopped to grow tall. This means what? Your bones are not lengthening anymore. So what happens after 30 years? Every year, you lose 0.01% of your bone. Every year. It is not so with those people who exercise, because you can stop that. Why do we have conditions like osteoporosis, loss of bone mass when people are growing old? Because they are not exercising, okay? So, for you to have what we call very good weight, and good weight it has to, for a man, good weight comprises of bone mass and muscle mass, not fat mass. Fat mass only makes you more of a woman than a man, okay? But very good weight for a man consists of muscle mass and bone mass, okay? Excluding the Fs. Which are the Fs? The Fs are the fat, okay? If you take weight minus the fat, minus the food, and minus the fluid, that is your exact weight. So the best time to take your weight, it's in the morning before you have eaten, and before you have drunk anything, okay? Assuming you do not have body fat. Now that is your ideal man weight, okay? Not female weight. So we have to practice against resistance. And yes?
For a man, which is approximately the best figure of weight?
Okay, can I answer that question after this? I'll address it, and any other question that will come. Please remind me. I'll tackle that after this. So, there's a hormone called cortisol, and it's a stress hormone, okay? When footballers and other athletes are running or competing, and this is so competitive, they produce a lot of cortisol. And that is a stress hormone. That is not exercise. So the problem with cortisol, it causes inflammation and destruction of your cells. So very good exercise or very good physical activity is going to lower the cortisol levels. So that is why it's important, if you are exercising, do not exercise to compete. Sasa. Tuko pamoja. Wakati nilikuwa naanza mazoezi, mimi niliona Kuna jamaa huwa anaamka asubuhi anaenda mazoezi. Na kwa sababu yeye amezoea na mimi sijazoea, nikafikiria wacha nimfuate, labda atanisaidia. Jamaa alinipeleka. Kaanza kuhema. And you know I'm struggling. Alafu anaangalia, kwani umebaki huko nyuma? Nang'ang'ana. You see, that now ceases to be an exercise. Ananitesa kwa sababu I want to keep up with his pace, but I'm not able. So when you want to start exercise, please usianza mazoezi na mtu amezoea. Sasa anza kivyako, ukitaka kutembea wewe tembea. Bora usisima until you are able now to so that you can you don't generate cortisol when you're supposed to. Exercise is supposed to help you. Then for those people who are fighting diabetes, exercise is very good for type 2 diabetes management. Okay? In fact, people who exercise and they have diabetes have their insulin levels reduced. Eventually, they do away with them. Because the problem with type 2 diabetes is sedentary sugar that is not utilized. So we want to pump that sugar into the muscles. And exercise will help that. And then the other thing, happy hormones that improve your mood, okay? You're going to have a natural generation of hormones like dopamine, endorphins that improve your mood. Now, there's some of you who might have been using drugs to get the same hormones. Now, the problem with using drugs to get the same hormones is you cannot sustain that, okay? It will just give you what we call episodes. So today you are happy, tomorrow you are down. But exercise will sustain those hormones, okay? So that all the time you have the confidence, you're happy, your mood is okay. So, and people who exercise are very stable, even by the way they are reasoning out things. Because any type of endurance, whether it's physical endurance or any type of endurance, makes you to be stable, including the way you talk, okay? Nice. So exercise will give you very stable hormones. Sex hormones balance, okay? You know, if you don't exercise for men, you tend to produce a lot of estrogens. Because if you make fat in the body, fat is also an estrogen producing factory. That is why ukiona mwanamume anaongeza mafuta, anaanza kuwa na breasts, sasa tuko pamoja. The penis becomes short, or you've never noted that. Yes, exactly. Mafuta ikiongezeka, ina produce estrogen. Estrogen makes you feminine. So all your manhood, you start losing your manhood, including the muscles. Because you cannot have muscles, you cannot have fat and have muscles at the same time. That will not happen. So your sex hormones will be compromised. You become less of a man. You start behaving like a lady because you're not exercising. Even reasoning becomes slow. You have very slow reaction time. Growth hormone, very important also for especially those people who reach what we call intensity. Exercise ambayo imefikia intensity is very important for generating the growth hormone. Nice. Exercise for and muscle health. I've talked a lot about this. Please attempt to make all your major muscles to work. Okay? This could be the muscles of your arms, the muscles of your legs, the muscles of your abdomen. Ensure that you target all those muscle groups. When you are exercising or when you are training in exercise, you also exercise your chest. The chest also has muscles. Did you know? The chest has muscles. So when it expands, you are exercising your chest muscles. Okay? So very important. And then we have the sympathetic nervous system. stimulates smooth muscles, okay, in the vein walls. Ushaikuta watu wako na varicose veins ama wako na problem with they have feet swelling. Have you ever seen that? Ama huku nyuma unaona kama ni worms, zimejikoil hivi. So that is what we call varicose veins. The blood is not able to go back. You can only help this with the exercise, okay? It helps to push the blood back into the heart. So this is the other pump I told you. It is the second pump. Because once your heart pumps blood out of it into the rest of the body, the only way you can return that blood back is to use your muscles. Also for your heart. I want to teach you a principle here. What do you call this animal? What do you call this animal? A cheetah? It's a cheetah. Now, this is a sprinting cheetah. And I want you to note what is here. Okay? As opposed to what is here. Where is this animal more developed? Is it the chest or the waist? The chest, eh? So the chest gives it what we call that springing action. The waist. And this is the way we are supposed to be. If you want to have very good mobility and to make your walking easy, walking for long distances, for running for long distances, then please ensure there is nothing on the waist apart from muscles. Nothing. Do not entertain fat in this area. Okay? Don't entertain weight on this area. Wanaume huwa wanajenga juu. Okay? Now, this is typical of any other animal that runs fast. Whether it's a horse, whether it's a dog, whether it's a leopard, okay? All of them, they have a big chest, but the waist is always narrow, okay? So to give them what we call the springing action. Now, I'll teach you something else. That for these animals, sometimes they spring to an extent, they make the angle between the ground and themselves to be almost zero. So it's springing, it can spring and it can be parallel to the ground. Now, for us men, somebody who can, because we say the ideal angle between the ground when you are springing, between the ground and your main body should be 70 degrees. Sawa sawa? Yaani huyo ni mtu wako physically fit. Sawa sawa? So this angle, if it's 70 degrees or less, man, you are a sprinter. Lakini unajua wanaume wengi hapa yao ni 90. Jamaa hajawahi. Hata akianza kukimbia anakimbia na 90. So we have a long way to go. Sawa sawa. So that would mean you always use your heel. So to make this angle be favorable, be very attractive, you have to use the front part of your foot. That is where your health starts. Lakini kama wewe ni mtu wa 90, heels all the time. Umekuwa kama mwanamke, unajua wanawake ni watu wa heels, That is why they love what? High-heeled shoes. Lakini mwanaume si mtu wa heels. Sawa sawa? Hapa mbele. So that is where health starts. Very important. Then I'll tell you something else. You see, the lung is like an inverted tree. Did you know that? By the way, this is not exaggeration. In fact, there is more of this in the lungs than what is in this picture. There are so many blood vessels. In fact, one of the organs that are heavily supplied with blood vessels is the lungs. Now, there is one problem. If you do not expand your lungs, if you do not have very good aeration of your lungs, now your blood vessels become narrower. And when they become narrower, you get less oxygen. It is only in the blood vessels of the lungs where when oxygen is deprived, is decreased, those blood vessels become narrow. When they become narrower, that's a problem. That is why people who smoke have very narrow blood vessels in the lungs. So that is why they get that disease we call the chronic obstructive lung disease. Are we together? Now, why we talk of a lung as an inverted tree is because our breathing system is the opposite, that one of a tree. When we are taking oxygen, during the day, plants are, you know what they are taking? Carbon dioxide. As we take out carbon dioxide, they are taking it and they are giving off oxygen. So we get use of that oxygen. So we behave the opposite. At night is also different. I'll tell you what happens at night. Now, this is where your heart is with respect to where the lungs are. Anytime you have inhaled in air and your lungs are expanding, you leave space. You leave space for the heart to fill with blood. So that if your lungs do not expand, meaning you are not breathing hard enough, so your lungs do not expand, then the amount of blood you receive back into the heart is small. And if it's small, means less energy. And if it's less energy, means you are not competitive. So train your heart to expand so as to give space to the heart to do what? To fill with blood. So when is the best time to exercise? It's in the morning if this is possible. Why? There's less oxygen in the morning. There's less oxygen, especially when before sunset. There's less oxygen. Because at night, plants use oxygen. And the best exercise is when you are straining for the little oxygen. When you're straining for or competing for that little oxygen in the morning with plants. Your lungs will expand to do what? So that they can make use of the little oxygen that is available. The other places you can get little oxygen or less oxygen is in the mountains, high altitude areas. That is why people who come from Europe and other places go to Eldoret because it's a high altitude area to train there. There's less oxygen there as opposed to Mombasa. Okay? So there's less oxygen. And if you have trained in areas with less oxygen, ukija huku kwa ground, unaona kama tu ni mchezo. Okay? Because your body has trained to endure. So during the day, the plants are making use of the carbon dioxide and they will release oxygen. So that oxygen will be used by you. Okay. Now, let's talk about exercise and water intake. Before you go for exercise, it is recommended that you take 3 glasses of water before you go for exercise. So that will help you to endure. Then after exercise, you need to to replenish your body with water. You know you have lost water through sweat. You need to compensate your body for the water that you have lost. For high intensity or long workouts, consider putting some salt in water. And not the water that, not the salt that we buy from the shops. We have whole salt, natural salt, that has all the elements. Okay? So if you get that one, you can add it in water. Why? If you can taste your sweat, how is it? It contains salt. So during high intensity or long workouts, you're losing water and you're losing salt at the same time. So you can add some salt. Then it's important to note this, that you consume 40 ml of water for every 1 kg of body weight. Okay? And water should be taken 1 hour before, or if you have taken a meal, then you can only take it 3 hours after you have taken the meal. Now, 40 ml per kg means what? If you're 70 kgs, how much water should you take? This is the daily allowance. How much water should you take? 2.8 liters. So how much did you take yesterday? Kuna walikunywa kachupa kamoja, alafu ikatosha. Okay? So this is the amount of water that you're supposed to take in a day, 2.8 liters for a 70 kg person. But it changes if you have exercised. Okay? Because you have to do what? You have to compensate for the water that you have lost. And then something else. If urine is dark, please know that you're dehydrated. Sasa. If it's pale, then you are likely to be hydrated. But if it's clear, we can say you are adequately hydrated. Kwa hivyo, usiwe wale watu wanaenda kukojoa wameangalia juu. Sasa. Angalia nini? Mkojo. Kama uko na rangi, jua maji haijatosha. Okay? Yeah, we need to see you through the urine. Sasa. So your color, the color of your urine will determine how much hydrated you are. Now, exercise is very good for the heart, but let's avoid treadmills. Let's avoid the kind of exercise you do in a room. Okay? We call it anaerobic. You don't have a lot of oxygen. Okay? And then the ground is not varied. We need to exercise in areas of where you're climbing up, going down, moving on a level surface to be able to benefit. So heart health, for good heart health, you need what you call aerobic exercise. That is exercise outside. So you can do brisk walking, jogging, running. It's important. If you can do any of these. If it's swimming, well and good, cycling, but the best one is where you can exercise all the muscles. Okay? Yeah, that will be good for heart health, and it should be done in the open. So other benefits of exercise, we have, you are going to have a very good heart muscle. It is going to lower your blood pressure. The other thing is, you've ever heard of bad cholesterol? Okay? And sometimes you have to take a drug to lower that cholesterol. Now, exercise will do that for you. Okay? It will do that for you. Then we've talked about better blood vessel function, reduced inflammation. If you have any inflammation in the body, whether it's arthritis, whether it's sinusitis, whether it's a respiratory inflammation, you have infections, any kind of inflammation, it is going to improve your is going to reduce that inflammation, especially when you exercise and take adequate water. Improved blood sugar control, we talked about it. Exercise for the brain, very important, reduces anxiety and depression, okay? Physical activity acts as an effective treatment for depression. By the way, you benefit a lot from exercise if you are depressed than if you took a pill. So you can just go out, do some workouts, okay, run, jog, whatever, and then you clear the depression. And the good thing about this, it is going to sustain you for a long time, as opposed to maybe drugs that you need to take all the time. So exercise is the best, even for stress management. You can do exercise as you meditate. Then improve mood and self-esteem. And here we mentioned you have to be consistent. Very good sleep. Those people who have problems with sleep, train to exercise, okay? Now look at this gentleman. So if you're very observant, what is wrong with this gentleman when he is exercising? What is he doing with his mouth? You want to show us that he is doing a very good job, isn't it? You should never open the mouth when you're doing what? When you're exercising, okay? Yeah. And that is why I want us to talk about what we call nasal breathing versus oral breathing. Nasal breathing is better than oral breathing because number one, there is what we call oxygen efficiency. There is a way oxygen is taken into the body, in the lungs. And this will not happen unless you breathe through the nose. There are three ways you benefit. There are three ways oxygen is prepared before it gets into the lungs. Number one, if it gets through your nostrils, it will get moisture because it needs to be moisturized. Number two, if oxygen gets through the nostrils, it is going to be warmed. This does not happen if it enters through the mouth. And number three, if oxygen enters through the nostrils, it's going to be filtered. So it will not contain dust particles. So it will not give you allergies. Then even number four, it will only enter in the right proportions. And I also told you that your nose is an air conditioner. It is not straight. There are those, we call them convolutions, or it twists. The path is not straight. And how that enables, or how that one benefits you, is because when air is entering your body through the nostrils, it forms a circular motion as it enters. So when it is moving in a circular motion, the nitrogen innate is converted into nitric oxide. That is a very good blood pressure medication, okay? So that by the time it gets into your lungs, it is compatible with the what? It is compatible with the medium or the gaseous exchange area, okay? Now the other thing is, when air enters the lungs, the cell that traps oxygen, is called what? What do you call the cell that traps oxygen in the lungs? It's called a red blood cell, okay? It's a red blood cell. It has 4 areas. It has four dockets for that oxygen, okay? But that 4 dockets, in order for oxygen to get in, the same 4 dockets have to release carbon monoxide. those 4 areas, they release carbon monoxide, okay? And then oxygen enters there. So this means what? The amount of carbon dioxide you remove from your body is equivalent to the amount of oxygen you get into the body. Meaning, even if you are to exaggerate and try to open your mouth so that you can have a lot of air, you're not going to get more air than what the blood cells can give. Because they have to release 4 molecules of carbon monoxide, which when it comes out, it becomes carbon dioxide. And then the air of the equal amount is going to attach. Are we together? So please, don't make it so, do not exaggerate by opening your mouth. You're not helping, okay? The amount of oxygen we need should only fit 4 points of your red blood cell, okay? So those who have trained to breathe through their nostrils will get enough, okay? You're not going to find it inadequate, no. The reason why people open their mouth is because they're exhausted. And opening your mouth will not stop you from getting exhausted. If you're exhausted, you're exhausted. Are we together? In fact, what will give you endurance is when you train to breathe through your nose. Because your lungs will just use enough and they will expand. Okay? And then you grow more blood cells. By the way, what you need to do is to grow more red blood cells with very good nutrition and training in high intensity so that next time you can trap a lot of oxygen. I hope that point is taken. So we also have, we know mouth breathing increases water loss, so that is not good. You're losing a lot of water when you're doing mouth breathing, okay? So the best way to breathe is through your nostrils. And then if you have if you want to have a very good heart rate. Now, who has measured their heart rate? Any recently? You've measured your heart rate? Do you know if you measure the heart rate of an athlete, you'll be shocked? Athletes, especially the long distant athletes. Do you know how low their heart rates can go? 30 something. Okay? As for me, I try a lot, but mine has never gone to, I try so that it gets to 40, but it has never. Mine is 46, 48. Okay? That is at rest. Okay? And their blood pressures, you can think, or you may think these people need to be admitted and pumped with fluids. Because their blood pressures are always less than 80, the highest. So they have 80 over 40 or 70 over 38, okay? So until when you ask whether they are athletes, you might think they are sick. So how has been your blood pressure yourself? Nyingine zenu, ziko na huko ma 120, ma 130. Huh? So one way to drop those blood pressures, okay, is to go for exercise and ensure you go for high intensity. Sasa, nikipima my blood pressure, yule huwa ananipima ananiambia, wewe kwenda kunywa maji. Namwambia hata nimekunywa maji saa hizi. Why? Because the blood pressure is 78 over 40 something. Okay? Sometimes it comes to 74. Okay? Na anaanza kuniangalia hivi namwambia mimi niko sawa. Mimi sina shida. Okay? So the best way to manage your blood pressure is, and please know this, nitric oxide, make use of the 78% nitrogen in the atmosphere. That is a very good medication for your blood pressure if you make use of it. People who have sedentary sugar. Sedentary sugar means what? Sugar is floating in the blood, is not utilized. And that is why they have diabetes, because sugar has no work. Please exercise your muscles. That sugar will go there. Okay? It's another way to control diabetes. Are we together? Those who want to have very good digestion, exercise will help. It helps the bowels to move. People have been talking of, I've been eating twice, I've been going to moving the bowels once. Exercise will enhance your bowels to move. It will also reduce inflammation. People who have gastritis and other conditions. It will improve the bacteria in your gut. Okay? Your bowels should keep moving. In fact, they always move. And you need to enhance that movement. Kuna kitu inaitwa kitovu hapa. Na wengine wenu wanasema mbona hii kitu iko hapa na sioni kazi yake. Hiyo kitu ni ya muhimu sana. Kitovu. It's a cord. And it attaches itself to the organs, to your abdominal organs. So anytime you are exercising the abdominal muscles, inakuwa kama ile kitu inavuruta. Okay? So by tying on your abdominal vessels, it does what? It enhances movement of your gut. Okay. Hii dawa lactate. Hii ni dawa ya depression. Now, how do you know you have attained intensity? You have to produce lactate. Where do you get lactate from? Lactate is a byproduct of glucose breakdown. So when glucose is being broken down very fast, because you are straining for oxygen, you are exercising, oxygen is not enough, and therefore you break part of the glucose, but then the other part forms what we call lactate. Lactate, it's so nice for stimulating your nerves. Okay? Stimulates your nerves, stimulates your heart. Very nice. But then, it has to be in the correct proportion. Because if you are not used to high intensity exercise, you produce a lot of lactate. And when you produce a lot of lactate, kuna mahali inafika, ina override ama ina exhaust. Inakuwa ya kwamba you have an oxygen deficit. Na unashikwa na vitu inaitwa spasms. Are we together? So, one way to assess whether somebody has become used to exercise. By the way, when you become used to exercises, you will not be straining. Meaning, your body has a way of recycling this lactate and converting it back to energy. Now, in order for you to understand what I mean, I'll show you a picture and then you can tell me what you learned from that picture. That is if you are very observant. Now, I want you to look at the front runners and tell me what is happening. What is wrong with one of them? Sorry? Jamaa amegundua haraka sana. Nani ako na muscle pull hapa? This guy, eh? Okay, did you watch this? Okay, you didn't. So, this guy has just sustained a muscle pull. So, if you look at how the others, the strides are, you know there's a problem here. Now, do you know what has caused that? Lactate. So, you know there's a problem with utilization of lactate. Anybody who is used to exercise easily converts the lactate back into energy or glucose. Okay? And this is one of the ways you are going to assess yourself as you start to exercise. Ukisikia umeanza kuhisi uchungu huku, now you feel like you want to stop. It is because your muscles they have not trained enough to convert back the lactate into glucose. So let's see some of the benefits of lactate. Number one is fuel and energy efficiency. So during intense exercise, muscles break down carbohydrates or glucose, and then they produce lactate. And this is a very crucial fuel source that can be converted back to energy. So the ability of your muscles or your body to convert back the lactate into energy proves that you have adapted to exercise. But it also gives you enhanced performance and endurance, okay? Because the amount of lactate that you have in the body, the ability of your body to remove it and reconvert it improves your heart health, okay? So that is a very important point. The lactate is also used to stimulate the brain. In fact, it is converted. It triggers the release of this factor. This is a very good relaxer of the brain, so that after exercise, you feel relaxed. It's a kind of feeling that is produced that is better than the one marijuana or any other drug can produce, okay? So this is a thing we should be looking for, as opposed to looking for drugs. It is also good for muscle repair, okay? Because once lactate is produced in the body, it enhances communication. So it will cause hormones to move, neurons to fire, and that gives you what? Very good health for the muscles, any muscle, anywhere. Whether it's of the heart, whether it's of the bowels, even the bowels can move, and you can have frequency of moving bowels, okay, as opposed to constipation. Then very good metabolic health. So the rate at which you convert carbohydrates or any other nutrients into energy is also enhanced. And of course, you have appetite regulation. So you have any craving for any drug. Now, exercise will reduce that craving. Because by exercising, you produce lactate. Lactate tames or reduces the cravings. Thank you so much. We've come to the end of that presentation, and now I will handle some questions. This is a summary of the benefits of exercise. We don't have to repeat this. We've talked about them. So you can pick any, and that's the summary. Now let's go to the question of our brother there. Remind me the question.
The approximate weight for a man.
Okay, the best weight for a man, the ideal weight for a man. Repeat the question again so that we can capture it.
What's the approximate weight for a man to hold? Yeah.
Okay, thank you. So in other words, he's asking which is the ideal weight for
a man.
For a man.
Yeah.
What do you think? To start with, your weight depends on... Your weight, by the way, to some extent is genetic,
Okay.
Because the size of your bones and how big they grow or what weight they accumulate will depend on certain factors from your parents, okay? But assuming now you are wholly by yourself to determine what weight you should have, then please be guided by the factors that you have very good nutrition. So we don't have an ideal answer, but you have very good nutrition, meaning you're not obese and you're not lean, okay? And then the other factors should be that your weight should not be as a result of accumulation of fat. So if your weight is purely bone mass and muscle mass, then we don't have a specific ideal weight. But we can say if you've not accumulated fat, okay, the other factors will be how your height, how high you are, and some genetic factors, okay? So those factors will also determine your weight. So what we use to measure the ideal weight is the BMI. It's called the body mass index, even for men. So this is what you do. We take your height, okay, in meters. So if you are 160 centimeters, that will be 1.6 meters. And then we take your weight. So if we take your weight, say 70 kgs, then we divide by your height squared. So we say 70 divided by 1.6 squared. Now, if your BMI, because the result will be your BMI, if your BMI is between 19 and 24, then you have an ideal weight for a man. Okay? May I repeat that? You take your weight in kilograms, say 70, and then we divide by your height in meters squared. So if that BMI lies between 19 and 24, then that is the ideal weight for you.
Okay.
Thank you. Any other question? Yes.
On the issue of
Okay, ask.
there is the issue of oxygen circulation.
Where does the issue of?
Oxygen circulation, when we had the issue of plants consuming oxygen and releasing carbon dioxide. And there was that thing of during the morning, you said that we are competing. There is low oxygen, so it's the right time for us to exercise.
Yes.
And so the ideology is okay, during the night, plants take in carbon dioxide.
They take in oxygen.
During the night?
Yes.
But that is when they do photosynthesis.
Plants do photosynthesis during the day.
It's during the day, not in the night.
No, they use sun's energy for photosynthesis.
Photosynthesis.
So that is when they are making use of carbon dioxide to make food. Yes.
Yeah. I think I forgot that one. I thought it was during the night.
Yeah, no, it's during the day. Yeah, because the photosynthesis will not happen in the absence of light.
So it's happening in the daytime.
Yes.
So that's why we have a deficit of oxygen during the day.
So during the night, they are using oxygen.
Oxygen, yeah.
So you'll be competing for that oxygen.
Oxygen with them.
Early in the morning.
Oh, yeah.
Yes.
So.
Good. Thank you for that. There's another question there. Yeah, you can pass the mic to him.
Between a person who practices calisthenics and a bodybuilder, who's more healthier? Between a calisthenic and a bodybuilder, who's more healthier?
Okay. So he is asking who is more healthy between a bodybuilder. And I think we talked about the extremes of exercise. Yeah, because all the factors have to remain constant. The food you're taking should not be extreme, because for a bodybuilder, they have to take a lot of proteins in excess to build strong muscles and big muscles. So that will be exaggerated. So I cannot say a bodybuilder has an ideal health. In fact, they are missing something because they are overdoing certain things. And the other problem, they tend to exercise the waist upwards. Okay? So they will lift a lot. Okay? But if you are to try them in what we call track events, they would fail. So that would tell you if they cannot tolerate track events, that would mean they do not have ideal health. Yeah. Any other question? Yeah. Pass the mic to him.
Okay, yesterday we were having a debate after watching a movie
Yes.
on how long a person can walk and the distance. So there were some of us who were saying they can walk in one single day 100 kilometers. And I was arguing with them and telling them, likely your feet will swell. And due to exhaustion, it is not possible. And then we had a second debate because they were saying it is possible to walk day and night continuously. And I told them if a person was to do this, it was possible that they will eventually die of exhaustion.
Okay.
So what's your take?
Anything has to be done with moderation, isn't it? Because life consists of many things you need to do during the day. Okay? And we do not want to overdo anything. So, as I said, the recommended duration of exercise for one day should be between 30 minutes to 1 hour. 30 minutes is enough, okay? And then you can do other activities. Because any extremes will mean either you are doing that for competition, and we said competition is not good for health, okay? It's good for money, but not good for, for your health. We do not exercise to compete. So that is where the problem is. If you're doing all these, if you're doing all this distance in running, that is going to affect your health because it is not moderated, and we need to have moderation in everything. Okay, thank you. Let's have the last hand. I hope you're not going to be late for your mid-morning breakfast. Pass the mic to him.
So the question is, blood clotting process comes with healing of the wound.
Okay.
So what is the connection between a person who is suffering from diabetes because they take time to heal? So what is the connection?
Okay, you know exercise is going to increase blood supply to the wound. Yeah, for the wound to heal faster, we need a lot of blood in that area. But we also need to get rid of waste, because it's only pure blood that is going to make that wound to heal faster. So if it has a lot of waste, that wound is going to delay in healing. So exercise you will sweat out the waste, okay? And part of it will come out of the skin, and that will minimize the amount of waste in the blood. So that one will also enhance the healing. So it will also increase nutrients in that area. So good blood supply, okay? It will promote healing, And if you're exercising, your blood will have less waste or no waste. And that is how the wound heals. Then you see, as you exercise, you also get rid of excess sugar. So part of it goes to the muscle, and part of it will be eliminated, even through your skin. Because blood sugar, when it goes to an area where you have a wound, and you know, there are certain microorganisms, such as fungus, they love areas with a lot of sugar. So they will keep the wound. They will keep the wound going instead of healing. But exercise can cleanse your body and get rid of that excess sugar. Thank you. Okay, the last question, and then we stop. I'll pass the mic to him.
I have a question, but it's outside the exercise.
Okay.
Can a physical head damage cause a mental illness?
Can a physical?
head damage.
Or physical head damage.
Yeah.
Uh-huh.
Can it cause a mental illness?
Yes, it can. It can. There are people who have mental problems because of trauma. They were hit in the head. Okay? And a very good example, they are the boxers. You know Muhammad Ali? Yeah. He developed memory loss when he was young. Yeah. He was also a mental case simply because they used to punch him. You know, the boxers will punch you in the head, isn't it? That is the easiest way to knock you out. And it has problems. Your very own Congestina. What happened to her? You know Congestina? Uh-huh. What happened to her? Now she is a mental case. Why? Because of physical injury to the head. Right. So it can cause mental problems. So that would mean boxing is not good, isn't it? Yeah. And if you work with the bikes, always ensure you put a helmet to protect your head. Yes. Thank you so much. We've come to the end of this session, and I thank you all for your participation. Yeah, we will rise up and do what we always do. Then we can say, Mike. Yeah, we can hold our hands together. Thank you so much. Let's meet next time.